This community update was brought to you by U Radio. Over the past few years, Manitoba has seen its rates of HIV and sexually transmitted and blood-borne infections continue to rise. The province recently released its surveillance data for 2023, which saw 280 new HIV cases reported in Manitoba, a 40.7% increase from the 199 cases in 2022. The infection rate has tripled since 2019, with marginalized communities being the most affected. Manitoba now has the second highest rate of new HIV cases in Canada, 3 times the national average. Persons who inject drugs were the largest driver of HIV transmission among both males and females, with 64 and 81.2% of cases. This year, from January 1st to November 29th, the Manitoba HIV program had 347 new referrals, which doesn't necessarily represent new infections, but individuals seeking services. Organizations like the community-centered Mount Carmel Clinic and Drop-In and Resource Center Sunshine House work directly with individuals and communities to provide care and support. Adam Hatta, Program Manager for Primary Health at Mount Carmel Clinic, emphasizes that it isn't an individual's fault. Through awareness and outreach, Hatta says they can help people feel comfortable approaching that part of their healthcare.
Early detection is key, right? If we can detect cases early on, we can help people get access to treatment as soon as possible, and that saves lives. Ultimately, creating awareness is also about normalizing STBBIs are common, right? Everyone from every walk of life gets STBBIs throughout their life. It's something that we should destigmatize by talking to each other about it, by being present, by not being afraid to show we're here, we care, and we will help you in getting access to testing and treatment.
The provincial government has invested over $8 million in initiatives to increase access to care and promote awareness of HIV in Manitoba. For Haddad, these investments and commitments from the government to tackle these rising rates of STBBIs are fantastic to see. However, for him and others at Mount Carmel Clinic, it's not simply about addressing rising rates, but improving each individual's quality of life.
It's not a numbers game, right? It's about people. And for that one person, this program could make all the difference. It's a difference between them having a life where they feel happy, fulfilled, comfortable in their own skin. And so when we look at why we do something, sure, numbers can support that, but the most important thing is how that initiative helps those individuals.
Mount Carmel Clinic, Sunshine House, and other community organizations were recently present at a wellness fair, an opportunity to be visible in the community, offering testing and vaccines, and a place to ask questions regarding health. According to Helena Zege, the Giza Winnamin director at Sunshine House, these outreach events are key in building community trust, with many led by individuals with lived experiences. Sunshine House's peer program empowers these individuals to create awareness and be directly involved in communities, understanding and learning what these communities and individuals needs. Tommy and Marge are members of the peer program.
It would be actually this one we're doing tonight, the drive for handing out testing and making it more commonplace to break down those barriers of stigma. I find that the stigma around it is insane. I know people who are open about their statuses, and then I know people who are so quiet and restricted with it and guarded. And I'd like to break down those barriers because, the best way to fight that stigma is to break those barriers down and talk about it, right? And get it out there. And why not get tested?
Although stigma often contributes to not seeking testing or treatment, Marge explains cost is another significant barrier.
One of the barriers is the stigma. Some people don't want to get tested because of how their friends and family will treat them afterwards. A former barrier was the cost of the medication, but now the government is going to help with that, which is awesome news. That's new.
HIV/AIDS medication, pre-exposure prophylaxis, PrEP, post-exposure prophylaxis, and antiretroviral therapy are now being provided through the government for free. A further barrier being removed is the requirement for healthcare providers to register to prescribe PrEP. However, Marge says having a support system is the most critical aspect of helping someone with an STBBI.
Having been someone that didn't have a support system in the beginning, being able to be that person that can be there, that's someone newly diagnosed or someone that even wants to just get tested. It makes them feel a lot better having someone that's experienced it than have a doctor throw information in your face.
That is the power the peer program, explains Zagay, as it brings care into the community and away from a clinical setting where people may be intimidated or scared. They note that supporting peers is paramount to the continued success of community outreach.
We are really fortunate with the degree of folks with lived experience that engage with our programming, similar to our partners here tonight as well. And I think the labor that peers and folks with lived experience provide, the knowledge and expertise and their ability to have those difficult conversations is something that is deeply undervalued. And I say that from the perspective of a lot of our peers having to be on EIA or having to work really hard to cobble together an income based off of multiple peer programs that they're involved in. And so one of the things that I would like to see long term is the recognition of people with lived experience and how impactful that is to supporting organizations like the ones here tonight doing this work.
Zagay adds that through further outreach and empathetic conversations, people are empowered. This leads them to getting tested and receiving necessary care, which helps reduce infection rates. You're listening to U Radio, where diverse voices connect. Stay tuned for more stories and insights that matter. With U Multicultural and the Local Journalism Initiative, I'm Ryan Funk.